Thank you, Ciarán. Taoiseach, as you know, obesity is a major issue in this country, indeed across the Western world, affecting children and affecting adults. And of course it requires a societal response and a full range of interventions. But today I want to focus in on those who are morbidly obese, and particularly morbidly obese public patients in this country, who need urgent intervention in the form of bariatric surgery, which saves lives for people who are morbidly obese. And clinicians have said that these people need this surgery to save their lives. Now, Minister Riley has rejected calls by Professor Donald O'Shea of St Vincent's to restore such surgery to St Vincent's. Only 20 operations have been carried out this year. They have no more funding to do any more life-saving operations. There's a waiting list of 200 at St Vincent's. These are people who clinically have been assessed, and the course of action is designed for them by the clinicians is to have this life-saving surgery carried out. But the Minister has been quite dismissive of the calls for the restoration of this surgery. He said prevention is better than cure. He said St Vincent's, quote, in their wisdom, decided to do the 20 operations in the first 5 months of the year. Now, I don't know if it occurred to Dr. Riley, to James Riley, to Minister Riley, but it wasn't just in their wisdom. That clinically they decided they wanted to save lives, and they wanted to do those 20 operations. And they need to do more, Taoiseach, because this is a callous and it's a dismissive response to a very serious issue for those patients who are involved there. It's not good enough to say, as the government is saying, tough on you, that you are now morbidly obese. We can't and we won't do anything for you. And the next operation will be 2015. That's what the government is saying. So the simple question I have to put to you, Taoiseach, is this. How many lives have to be lost before the government will get the message and intervene and do the right thing here in terms of the prioritisation of life over death?
Thank you. Taoiseach.
I regret if the language used by Minister Riley in referring to the process by which 20 important surgical interventions were carried out was deemed to be callous or not caring by Deputy Martin. I'd be certainly sorry about that. I've noted this report. I think Dr. Riley also said that you don't have sufficient resources available to do every operation that you might like to do. And for that reason, I understand that the clinician involved, who's a very skilled person, carried out the 20 operations in the first half of this year. I'm not competent to say on what basis they were prioritised, or whether those who are on the waiting list are in a more serious condition than those who were operated on, or whatever. But I do believe, as you do yourself, that prevention is better than cure. This is an issue that is arising and has arisen over the last number of years in the country, despite the fact that there is a massive voluntary movement in terms of the health initiatives that people take about diets and activity and exercise and all of these very important issues. Minister Riley made the point that there is not an endless resource for this particular operation, or indeed for any other. He also made the point about the extraordinary level of commitment that's required for very essential drugs, where, for instance, hepatitis C, with the 95% curable rate of what's now going to be developed down in AbbVie and Sligo. And in these cases, I'm quite sure that while the monies are not there now to do all the operations that might be deemed to be necessary by the clinicians, I'm sure it's possible for the clinician expertise to be able to say, well, what can we do for you in the meantime, pending your operation being available to you? Deputy Martin's aware that, given the circumstances that apply, people have unfortunately had to wait for a very long time for many different kinds of operations, and still do, much too long in many cases. You point out this case. But I'm quite sure that this is an issue that has unfortunately has to be dealt with by these people, and pending a clinician's assessment of the necessity for an operation, I'm quite sure that in the area of advice to deal with the problem in the meantime, that's available. Quite clearly, as I say, clinicians know best about the urgency of carrying out an operation if it's to be a life-saving operation.
Thank you.
And on that basis, I'm sure that they prioritise these things. Of the 20 operations carried out this year, I hope that they've been successful. Dr. Riley made the point, if you take money from other priority areas where operations are required, you don't do other people with different ailments any favours either. It's simply a case, Deputy Martin, of not having money to do all the things that you need to do or that you might like to do just now. So in the meantime, I would hope that the expertise available from the clinicians would be available to people who are deemed to have a requirement to have an operation carried out at some stage.
Deputy Martin, 1 minute. Thank you.
But I put it to you, Taoiseach, that you insult those who are morbidly obese when you say prevention is better than cure. You're actually insulting those people right now. We're talking about people who could be 20 plus stone, 24 stone, facing imminent organ failure. You wouldn't say that to a heart patient, and you wouldn't say it to a cancer patient. We have developed those services in terms of cancer and so on, where we want immediate intervention based on clinical assessment. Professor O'Shea has made a very good point when he said that obese patients were subject to the last remaining acceptable discrimination, because you don't really take it seriously enough. You don't get it that this is a life-saving operation. This isn't a lifestyle choice for the people concerned right now. It's actually an urgent, essential surgical intervention that is required to prevent loss of life. Now, we do prioritise in our health service.
Thank you.
Always would prioritise in terms of life-saving interventions vis-à-vis non-life-saving surgical interventions.
Question, please.
And you've chosen not to do this on this occasion. And there are other areas where you're spending millions.
Sorry,
millions.
we're over time. Thank you.
In terms of providing medical cards to those who will be healthy and will be young, but you've taken that choice. But here in a small number of people here, there's 200 on a waiting list right now. You have it within your capacity to do it. If you just stop insulting people.
Sorry, would you put your question?
And stop saying to them, tough that you're morbidly obese. Prevention is better than cure. That's not good enough, Taoiseach. Yes, that's what's being said.
Sorry, please.
That is what is being said. In reality, that's what's being said.
Please put your question.
So, Taoiseach, what I want to ask you to do, would you engage with the clinicians involved here? Would you meet with them? And would you work out with them and the hospital
Thank you.
a solution to this, which will ensure that the life-saving surgery that is required happens? And it can happen, Taoiseach, and you know it. You did it with the discretionary medical cards, despite we've been on for 2 years. You can do it here too, if you intervene effectively and appropriately on it.
Micheál.
I'm not sure whether the heat is getting to you or not, Deputy Martin, but I mean, for you to stand up here and say that I insulted people who have a problem because they happen to be obese and morbidly so is just wrong. There are what they call bariatric services are provided in 2 public hospitals, St Vincent's here in Dublin and Galway University Hospital, and that forms part of the HSE's overall response to this particular problem. In relation to St Vincent's Hospital, where Dr. O'Shea operates, this service was originally provided by St Columcille's Hospital, and in the context of that reconfiguration within the hospital group, the service was transferred to St Vincent's last year. As you said we prioritise patients. This is a matter for clinicians and medical expertise. So specific funding was provided then to have continuity of the service provided. Typically, St Columcille's carried out about 20 cases per year. We are advised by St Vincent's that they've provided in excess of that this year to date. With regard to University College Hospital in Galway, I understand that they treat on average 50 cases per year, and they're not anticipating any reduction in the service levels of this year, 2014. Now, here's an important point for you. While there is a definite clinical need, and where that exists for those with chronic obesity, bariatric surgery is required for a minority of obese patients, 2% of the population. The vast majority require clinical treatment that is both hospital-based and community-based. The HSE will continue to further development of this service in 2015 and beyond within the overall context of the service planning process. Now, you make the point that these are life-saving operations. On that basis, I would assume that the clinicians who know best here would prioritise which of the patients need to be dealt with most urgently. You ask me to meet the clinicians who point out about the discretionary medical cards. In many cases, the persons who are now receiving their discretionary medical cards back have conditions and challenges that will last all their lives, and they may live for a very, very long time, and we hope that be the case. In this case, in these cases here, it is a matter for the clinician to prioritise on his or her expertise who should be treated next. And you don't expect, I'm quite sure, you don't expect a minister to start taking money away from other priority cases that are deemed by clinicians to be very urgent as well, be they cancer, be they leukemias, be they whatever. And I'm sure you're not asking for that. So it's a case of 70 cases here being dealt with, 50 in Galway, 20 in St. Vincent's, on a priority basis. But if the service is community-based and hospital-based, I'm quite sure that the specialist information and expertise from the clinicians is available to those patients who are going to need these operations in due course.